Hey everyone, I want to introduce you to Dr. Brian Chung of Upper East Smiles. Brian is a periodontist and just opened a beautiful new dental clinic. It's a state-of-the-art clinic and it truly is a beautiful place. And we were discussing ways to collaborate on certain things that we see commonly. And of course, TMJ dysfunction, temporomandibular dysfunction, often comes up when we talk about how we manage it in physical therapy and also in the dental world. So Brian, tell us a little bit about how you manage TMJ and how you evaluate it when a patient first walks into the clinic and you see it.
Sure. So when TMD patients, TMJ disease patients or TMJ dysfunction patients come in, we do the joint examination as well as the teeth and periodontal examination. There are some intraoral signs or extraoral signs of TMD, such as incisal or occlusal wear, or basically wear on the teeth surfaces, or abfraction lesions, which is basically on the facial outside of the surface that can be damaged or loss of enamel structure, or even severe cases you can get fractures around the teeth and worsening the situation. So for these patients, the most conservative approach would be to make sure the bite and periodontal health is good, and that we make an acrylic-based guard. We call it occlusal guard, or a night guard, because we usually have the patients wear during the nighttime.
Yeah. And so in the physical therapy world, we see a ton of TMJ patients, and there's so many different manifestations of the pain and the dysfunction that comes along with it, right? So,
correct.
When someone comes in, we always like to work on the conservative management side, which is we do a lot of direct traction techniques intraorally, different types of mobilization and glides of the temporomandibular joint. We do soft tissue work or tissue releases of the pterygoids or the musculature that we can access inside the mouth, and then also some soft tissue work of some of the muscles of mastication on the outside, like the masseter, and also while also focusing on associated cervical spine pain, or if there's cervicogenic headaches or headaches derived from the base of the spine that can also come from a lot of clenching.
Sure.
So in combination of that, we always like to manage it with a night guard and a proper dental exam, because it's one of those things that really do need to be managed on both sides, right?
Right, I completely agree. So if the occlusion or the bite is not quite right for the patients, it can worsen the TMD symptoms. So sometimes we do, not only with the physical therapy, for indentally we do obviously do the conservative approach with using the night guard, but sometimes we do restorative treatment, or even orthodontically we move the teeth into the correct stable bite and continue the physical therapy route.
Yeah.
And we've had a great success together here.
Yeah. So I think the important takeaway from a lot of this is understanding that temporal mandibular dysfunction or disease is not, there's not one treatment that fits everybody. It's understanding your exact bite, fine-tuning the treatment that will include a night guard most likely, and then restorative if necessary, or if we can manage it even more conservatively, focus on a night guard and sometimes soft tissue work and mobilizations of the joint to relieve pain and stress, right?
Yes.
So Brian at Upper East Smiles is nice enough to offer all Equilibrium patients a 20% discount. So if you mention Equilibrium up on the 5th floor, you can receive a 20% discount on night guards, which really makes this a little bit more affordable. I know some of these night guards can be cost prohibitive, so having better access to a really nice, well-made acrylic night guard that's gonna last you a really long time is really important, and now you can get a little bit of a discount. So thank you, Brian.
All right, you're welcome. Thank you.